Hello there, welcome to another episode of Putting Dr. G on the Spot in the month of February when we're celebrating Valentine's Day yesterday. So during the whole month of February, we're talking about the love pills. We started off talking about the various types of the blue pills and also various types of different pharmacokinetics. And this time, we're going to ask whether it is possible to have the love pills on a daily basis. In fact, there are two types of PDE5 inhibitors. One of them is short-acting, the other one is long-acting. When you think about long-acting, which actually have a half-life of about 36 hours, will this be a medicine that you can take on a daily basis? In fact, there is a slower dose of PDE5 inhibitors called tadalafil, 5 mg that is taken on a daily basis. Why is that an advantage? Some people actually think that taking this on a daily basis actually will enhance the blood flow to the penis as compared to on demand. So that reduces the peak and trough of the actual medication if you take the drug on demand. So for patients, that creates a lot of spontaneity. However, there's a lot more than that. If you take daily dose of PDE5 inhibitors, then you realize that it also helps with other medical conditions. For example, benign prostatic hyperplasia. When the prostate becomes too big, by taking 5 mg of PDE5 inhibitors, you realize that the urine flow is stronger and frequency and urgency of urine is also less. There are two other medical conditions also being used. For example, pulmonary artery hypertension. So this is a condition where the constriction of the artery to the lungs causes tiredness and also shortness of breath. When you take this, perfusion of the lung is increased and the energy level goes up. And lastly, there's a condition called Raynaud's disease where the arteries to the fingers and also end organ becomes less. By taking this medication, it enhances the blood flow for people who suffer from Raynaud's conditions. One last condition actually is called penile rehabilitation. If a patient is to undergo radical prostatectomy for prostate cancer, for example, then by taking the medication 3 months before the actual surgery, it will reduce the risk of somebody having erectile dysfunction after the operation. For next week, we would have gone into the year of the horse, and then therefore we're going to talk about something else, which is a myth busters about all the love pills. And you need to stay tuned for next week's Putting Dr. G on the Spot.